Evening, everyone. A warm welcome to this neurotherapy session of part 2 of gestational diabetes. And today, sir will be completing or giving complete information on what to do, how to do the treatments, further treatments. Because in part 1, we had learned that some parts were covered, but in this session, more parts and more treatments will be covered so that you can understand what can be done better for those patients who are in pregnancy stage and who are suffering from gestational diabetes. And meanwhile, we have a question on femur bone, which Ramchandran sir will be answering now. So this is not part of gestational diabetes, but please note, this is an extra added bonus for all of you, for those who have joined now today, so that you can learn from them and you can use it for all your family and friends so that it can be helpful. And neurotherapy, we in Joshys Kerala Group, we always welcome alternative therapies, especially so that you all have wide and varied knowledge of all therapies, because some therapies can't be used for everyone and in all cases. So you have to be very much ready to, or you will be having a wide range of information when you are having extra therapies in your hand so that you can use it wisely. So on this day today, on 2nd May 2025, I welcome you to part 2 of gestational diabetes. And with all your love and gratitude, let us give a warm welcome to Ramachandran sir. Good evening, sir. Warm welcome to you. Please take over the session, sir. Thank you so much.
Okay. Yes, madam. You can ask your question.
Namaskar, sir.
Namaskar.
I am Yasmin Hirani. And 5 weeks back, I had a fall in the house only. Just I sat down on the floor and with a twist in my right knee. And my right knee, above the knee, the femur bone fractured. It is operated. Now it's 5 weeks to that. But the calcification is very slow. And the doctor has recommended me to take 1 month injection of Jamfrac, which is, I think, thyroid hormone. But I am very skeptical because daily injection like insulin, I must take it. And I follow homeopathy medicine otherwise and other alternative therapies. But I'm not taking allopathy. I'm skeptical about taking the injection also. So can you suggest something that will help my calcification faster?
Yeah, certainly. For all healing purposes, we have got a treatment called 60-toe finger gall liver. I have been speaking about this treatment in many of my classes. I hope I am sure there is somewhere in the group, in Joshys Kerala Group itself, there is this video. I have shown a video of a lady doing it on a small child, 60-toe finger gall liver. It's called. If you go and look at this treatment, then it's a very simple treatment. It can be done preferably by somebody else. Otherwise, you can do it on your own. Okay. But because we have now have problem with the femur bone, it's best that you keep your legs straight ahead, and then it can be done by somebody else. That will be the best.
Okay, sir.
So that treatment will be very useful for you.
Can you name the treatment again, sir?
Yeah, 60-toe finger TF. It's called toe finger gall liver, 60 TFGL. That's how I think.
60 TFGL.
Yeah. 60 TFGL is what the name I would have put it over there. And don't worry, in case it is not there by this night, I will upload it. But you try to locate it now, and you can, in case you locate it, you can also inform me that you have located it. Okay.
Okay, sir.
In the group. Yes.
Okay.
And wish you all
any
a speedy recovery.
Supplements that I can take?
You know, is there a wound over there?
No, it is operated. A plate has been put with 10 screws. That is done, but the operated so fractured part is not being calcified completely.
Yeah, I agree. Yeah. That takes time. Internal healing. For that, only liver. One is this 60 TFGL and the other is my liver point. Both of them.
One liver.
Yeah,
one liver.
1 point liver. Yes.
Yeah,
1 point liver into 6. This
I
can be
that.
taken. And no, another thing. Wait a minute. Another thing, for overall protein digestion and for support for this other organs, that CNNS gas, which I do from here like this. I'm sure you must have seen it. I
Yeah,
will also,
CNF gas.
yeah, these three, you can take it by turns, go on taking it. They will help you for a very speedy recovery. And actually, even for pain removal, if there is any pain, it will also be reduced.
Okay, this will help in pain also.
Yes.
Okay, thank you very much, sir.
Oh,
I will
welcome.
go through the videos, whatever I can find, others I'll buzz you.
Yeah, otherwise you can write it in the group, and I will send it by the night or by tomorrow morning.
Okay, sir. Okay, thank you so much, sir.
Okay, my pleasure.
God bless you.
Yes, sir. Yes, madam. God bless you also. Okay, so now we have got almost 50 people. Thank all of those who have joined later, and thank those. And I once again tell all of you, those who are here, in case you know any person who is in any stage of pregnancy, they can join this immediately today. And even Anusha madam has been telling this, so you can help them, because this is not a class which will be repeated for quite some more time. And that's why this is the second class. I have gone very slowly, and I hope I have been patient to the extent you people expected. And I hope I have been teaching properly. So please inform more people if you can. Okay. Thank you very much. Now we start this session. Now here, let us all pay obeisance to the founder of neurotherapy, Dr. Lajpat Rai Mehra, whom you can see on the screen. And he dedicated his life in the service of mankind through his unique medicineless therapy. There are many medicineless therapies, but this therapy is really unique, really wonderful. And those of you who will be later on attending my regular classes, I will be announcing shortly. For them, you will get to know a lot more about him. What a great personality he was. So he founded this alternative method in the year 1943. He was born in the year 1932. So 1932 to 1943 is 11 years. At the age of 11, a young boy has formulated a therapy. Of course, it was called neurotherapy much later, but he formulated the fundamental postulates of this therapy, and he went on studying and studying and studying. And then he has made this wonderful therapy, which has stood the test of time. More than 8 to 10 lakhs of people have been benefited over the past 30 years, and 3 decades or more. So, and in fact, he has been working for about 70 years on this therapy before he passed away. Okay, so that's what it is. Now, today's topic is gestational diabetes. It is true that it is a temporary condition, but it has lifelong implications. That is what we have to understand. And in our previous class, we covered the following topics. We saw about the introduction and pathophysiology. Then we saw the difference between GDM. GDM is a short abbreviation for gestational diabetes mellitus, GDM, and overt DM. DM is diabetes mellitus. Then difference between GDM and DM type 2. Then what are the causes? What are the risk factors? Then some ladies feel that gestational diabetes, is it my fault? We answered that question. We then found out how gestational diabetes affects babies, and why does GDM make the baby bigger? And then we saw the signs and symptoms, and how to control GDM in 3rd trimester, and whether GDM can be prevented. So now, today, we will continue in this vein, and we'll go to the next slide. Other possible complications of GD. ED or GDM is the same. We can write it as GDM. Okay. Then a greater risk of jaundice. You know, just postnatal jaundice is a thing which many people, many children have, but it is not always very alarming, but it is a bit alarming. And for that also, our 1-point liver into 6 is a very, very wonderful treatment. It can be given to children of all ages. So postnatal, this thing also, it is very useful. And then it causes injury to the baby and the mother during delivery. And then it invariably lands up with an emergency or planned cesarean delivery because of the large infant size. The size of the baby becomes very large. And then there are the chances of hemorrhage and chances of dying before or following birth. This is another, because the baby is very big, then there can be hemorrhages, then chances of the baby dying before or following birth. And then a child or teen whose mother had GD was nearly twice as likely to develop diabetes before the age of 22. That means they are quite likely to become juvenile diabetics. So this is it. Now, how do we diagnose gestational diabetes? Gestational diabetes mellitus, that is GDM, is a condition where a woman without diabetes develops high blood sugar during pregnancy. But how do doctors diagnose it? Then there are a few methods. So we'll see each one of them. One is very common, the oral glucose tolerance test, OGTT. And this is the gold standard for diagnosing GDM. And it is usually done between 24 and 28 years of pregnancy. 24 and 28 weeks of pregnancy, sorry. And how do you do it? You fast overnight, and then your fasting blood sugar is tested. After that, you will be given a sweet glucose drink. And then about 75 grams of sugar should be there. And then your blood is tested at 2 times, once after 1 hour and once after 2 hours. So that is called the oral glucose tolerance test. Okay. And then what are the numbers? Now, according to the American Diabetes Association, that is called ADA. So GDM is diagnosed if one or following of these values are met. One is fasting blood sugar of 92 mg per dl or more. So then 1 hour, it should be less than 180 mg per dl. More than that, it is called the GD. And at 2 hours, it should be 153. Because after eating anything, immediately the blood sugar will rise. But within 1 hour, it should come to 180. And within 2 hours, it should come down to 153. So now let us have an example. It's a pregnant woman. Suppose she has fasting 96. Instead of blood sugar should be less than 92, she is having fasting of 96. And then in 1 hour, she is having 172, which is less. But 2 hours, 160. Even though her 1 hour value is normal, the fasting level and 2 hour values are high. So yes, she has GDM. So that means though in 1 hour it was a bit less than the normal, this was 180 and this was only 172. But 2 hours, in 2 hours she could not digest the glucose, and so it went to 160, whereas anything more than 153 is GDM. So this is how a very simple way to understand GDM. Okay. Sorry. Then next is the two-step method. This is mostly used in the United States. This method involves 2 stages. In the first step, there is no fasting required. So that is a good thing. No fasting required. You drink a 50-gram glucose drink, and then your blood is checked after 1 hour. But here, the blood sugar, if it is more than 140 mg, then you go to step 2. Then step 2 is a 100-gram glucose tolerance test. That means this is done after fasting, and your blood is checked 4 times. Here it was you drank a 50-gram. Next you have to drink a 100-gram this thing and see how you tolerate it. Then it is checked 4 times, fasting 1 hour, 2 hours, and 3 hours. So this is a different. This is called the two-step method. And if any 2 of the following are high, fasting 95 or more, any 2, 1 hour 180 or more, 2 hour 155 or more, 3 hour 140 or more. So here it was your blood sugar after 1 hour was 140. Then you have to drink this 100-gram glucose, and then after 1 hour, even if it is 180 or more, then it is GDM, etc. So it's a very simple method, but this is mostly used in the United States. Still, for knowledge, some practices do come down to India also. So that is why I give you this theory. Then let us go to an example. supposing her results are fasting 100, 1 hour 182, 2 hour 150, and 3 hour 135. So here, these two are very high. These two are okay. These two are okay, 2 hour and 3 hour. But still, fasting and 1 hour are high. So it confirms GDM. Now, third test. After 2, we have come to the third test, that is fasting blood sugar. So this is called early pregnancy screening. In early pregnancy, doctors may check your fasting blood sugar to screen for GDM, especially if you are at high risk. And we'll see the risk also. We have seen risk factors earlier also. If your fasting glucose is 92 mg per dl or higher, then it suggests that your body may be insulin resistant. And so at that time, we'll have to do a OGTT follow-up. OGTT has to be done. Okay, then example, fasting sugar is 94 mg per dl in the first trimester. That is the first 3 months. Then that's a warning sign and further testing is needed. So this is how we are ensuring the testing. Then fourth one, this is the standard test for all diabetics, that is HbA1c, glycated hemoglobin test. So this HbA1c measures your average blood sugar over the past 3 months. It is usually used to detect pre-existing diabetes. So it is usually used to detect pre-existing diabetes, not specifically GDM. But if it is done in early pregnancy, normally this HbA1c is done for all diabetics, for pre-diabetics, etc. But here, if it is done in early pregnancy and you get a value of 6.5 or more, then it might mean that the diabetes was already there, what we called as overt diabetes. We have seen overt diabetes in the last class, and it is not just GDM. So if someone's HbA1c is 7%, that is more than 6.5, then they likely had diabetes before pregnancy, but it was detected only after pregnancy. That means the diabetes was there, but it was detected later. So it needs to be managed carefully. Okay. Then summary. Now we are just summarizing the 4 diagnostic techniques for GDM. So one is the OGTT, that is the 75-gram test, and this is used worldwide. Then 2-step testing with a 50-gram screen and a 100-gram diagnostic test. Then fasting glucose test, especially early in pregnancy. Then HbA1c for ruling out pre-existing diabetes. And what is the main aim? All these tests aim to catch GDM early so that both mother and baby stay healthy. Okay. So now we'll slowly come to the treatments within a short time. Now, gestational diabetes can sound scary, but the good news is it is treatable. We'll see the treatment. With the right plan, most women with GDM go on to have healthy pregnancies and healthy babies. This is the best part of it. With the right plan, most women with GDM go on to have healthy pregnancies and healthy babies. So let us see how gestational diabetes is managed, including some modern elementary techniques that go beyond just food and medicine. Okay, first we have got a number of therapies or therapeutic approaches. So first we come to the medical nutrition therapy. And here the important principle is nutrition is the foundation of treatment. In fact, for all diabetics, I always used to say the protocol should be DET. That means diet, exercise, and finally only we come to treatment. If diet and exercise are properly done and done at a preliminary stage, then you may not require any treatment at all. That's the beauty about it. So DET. So like that, in D, nutrition is the foundation of the treatment. So what you should do, you should plan the balanced meals that keep your blood sugar steady. That means spacing out meals and snacks. Don't eat a large amount at a time. Eat every 2 hours or every 2 hours or 3 hours, and then focus on complex carbs like whole grains and legumes. That is very essential. In fact, these whole grains, they have got one good quality also, that even if you are putting a whole grain, any whole grain, whatever be it. So you put it in water and soak it overnight, and the next morning you drink that water. That is full of nutrition, that is full of so many vitamins, natural vitamins. Okay. Ankurit moong, that means the sprouted moong. The water before you used for sprouting the moong is an excellent nutritious tonic of containing vitamin B12, and it's a very natural vitamin B12 tonic. So apart from that, of course, the sprouted moong itself has got a great value, but the water should not be thrown. It should not be boiled also. It should be drunk with whatever, with a little bit salt, sugar, I mean salt or whatever, if he wants, salt, lemon, salt, anything you can put in that water and you can drink it. It's a very nutritious drink. So all of you, those of you who are interested in taking care of your health, whether you have diabetes or not, you can start this principle. They sprout just 1 spoon, small spoon, teaspoon is enough. 1 teaspoon of moong, that green gram, then whole green gram. You just put it in water, soak it overnight, and next morning you drink it on empty stomach. You will see how much it helps your hemoglobin, it helps your energy, it helps your nervous system. So many benefits you will get. Okay. So that is why whole grains and legumes are very, very important. Then pair carbs with protein and fiber to avoid sugar spikes. That means don't only go with complex carbohydrates, pair it with protein and fiber. So a whole grain roti with paneer and a side of salad is much better than plain white rice with potatoes. Now most of us take plain white rice with potatoes, of course with dal or whatever, sabji, etc. Instead of plain white rice, if you have whole grain, you cannot of course have whole grain rice, but you can have whole grain wheat grain. So whole grain roti you can prepare. So many grains are there, and millets are there, a very, very useful source of nutrition for diabetics that way. So you are not really avoiding carbs, you are managing them. Okay, so this is one thing. Then next one is very important, is physical activity, diet and exercise. DET, diet, exercise. Now for exercise, you have to keep moving your body, and exercise helps your muscles use up blood sugar and improves insulin sensitivity. In this context, I want to inform all of you that there is a state of muscle deterioration. It is called sarcopenia. Sarcopenia. You can all Google about it and find out. It is not. It can happen. Sarcopenia starts muscle deterioration right from the age of 30 or so, and from the age of 30 and then up to the age of 60 and 70, then it becomes much faster. In the age of 30, it is about 0.5% per year. Like that, it goes on increasing to 5 to 10% later on as we become 60s and 70s. And that is one of the reasons why people at an old age become infirm. So all of you, please understand, for getting rid of sarcopenia, or rather preventing sarcopenia from happening, sarcopenia is in fact as dangerous a disease as diabetes. I use dangerous in quotes. Okay, dangerous does not mean you are going to die, but definitely you are going to lead a very, very poor quality of life if you have sarcopenia or if you have diabetes. And I want to help you to prevent that. In one of these next coming sessions, I may handle a case of sarcopenia. I may handle a lecture on sarcopenia if time permits. So one of these other days, we can think about it. It is very useful for all of you to know. And it is where there even neurotherapy has got second this thing, first place goes to exercise. And any exercise, the general advice is, if you can walk, run. If you can only sit, then start walking. Like that, everything should be based on activity, physical activity. Okay, so move your body. Exercise helps your muscles to use up blood sugar and improves. And just 30 minutes a day of walking, prenatal yoga, or even dancing can make a huge difference. And a short Walk 15 to 30 minutes after meals can prevent sugar spikes. So the statement is that after dinner, rest a while, after supper, walk a mile. So that after supper, walk a mile is very useful. So 15 to 30 minutes after meals can prevent sugar spikes. Okay. Then now we are talking about a holistic approach that looks at the whole person. So it involves what? It is also, this thing, by coincidentally, it is also having the acronym LMNT: lifestyle, mental health, nutrition, and tracking. So in lifestyle, what are the most important things? Sleep, daily rhythm, and screen time. Preferably, the advice is for old people after 60, make sure you are switching off all electronic items by 9:30 or latest by 10 o'clock. Even if you go to sleep at 11:30, suppose for any reason you have to work, but let that work be without this thing, without the TV, monitor, the TV or the mobile, etc. Let that be on the computer, anything, even computer is bad. So let that be any other activity. Okay, that is one very good thing you must understand. So sleep, daily rhythm, and screen time affect your hormones and insulin. So prioritize 7 to 9 hours of sleep. At least 6 hours of quality sleep is very essential. Okay, reduce late night eating. This is another thing. Even if you are unable to sleep on time, at least finish your dinner by 7 o'clock or 6:30 or 7. Become a Jaini. Jainis don't eat anything. They don't even drink water after sunset. So try to become as much as possible. Late night eating should be avoided to prevent any chance of diabetes. Okay. Then M is mental health. Now stress increases cortisol, and cortisol increases blood sugar. So managing stress is the key. So deep breathing, guided medication, all these things, the guided meditation, journaling, or simply talking to someone you trust. Just talk to somebody at night without taking this thing, without looking at the screen. You can talk. Now, you will say again, for talking you need the mobile, but doesn't matter. You can put on the headphone, keep the mobile far away from you, and talk with another person of your age or anything. Even it can be a child also. It can be a relative, or it need not be a relative. It can be anybody with whom you enjoy talking to. In fact, in the earlier days, people used to, prayer was not only related to only slokas or Sanskrit slokas or anything like that, or any other language slokas. Prayer was an intense talking to God, thinking the God is in front of you, and when you think the God is in front of you, he is there. It is known in every religion that God is a physical existence for people who believe in his existence. So this is a very good thing. Talking to someone you trust. God is the person who will not betray our trust, who will not tell about us to another person, who will not talk about our difficulties to somebody else and make fun of us. So he is the best. See, that is a solution, but then otherwise talk to somebody whom you trust. Then nutrition we have already covered. And fourth is T, tracking, LMNT. The T is for tracking. What is the tracking meaning? Monitor your blood sugar using a glucometer. Most women check it fasting in the morning and 1 or 2 hours after meals. So this tracking should be done periodically at least. Okay. Now what are the target ranges? Fasting 95 mg, then 1 hour post meal 140, 2 hour post meal 120. And this is tracking will help you to understand your body's response to food, stress, and sleep. And all these are very essential for keeping your blood sugar low. Then medication if needed. Okay. So if lifestyle and elementary techniques aren't enough to keep sugar levels in range, your doctor may recommend insulin injections. They are the safest, or oral medications like metformin. But don't worry, medications are safe when used properly, and they are often temporary. That means as soon as your baby is delivered, your diabetes will go away in most cases with proper medication. Okay. Now let us see neurotherapy support for GDM. This is where we come to another this thing. I will have to just stop share for a few seconds. We have to see two other PDFs. They will give you a good picture. Okay. Okay. Now we are. Okay. Okay. I hope you're all able to see it. Right. Fine. Okay. So now we come to the first one. Now this is just a simple summary. I will go to each one later on, and then we will have, once you see this, then we will be having a hands-on demonstration also. So first, for elementary treatment for protocol, we have got a digestive stimulation, that is for the gut-brain axis, and then here the goal is to improve digestion and gut hormone balance. Okay, we'll talk about it in soon. What are this GLP-1, etc.? GLP-1 is released by the gut after meals. It stimulates insulin, inhibits glucagon, delays gastric emptying, and promotes satiety. So we'll also talk about GLP-1 again shortly. Then you have got the formula. I'll be talking about this formula. This formula has been shown in our previous diabetic challenge class. So we'll be showing it here also. And later on, people who are having any requirement, they can contact me personally, okay, on my phone or WhatsApp number. Okay. So digestion, this is the formula. Then absorption, digestion and absorption formula. Then enteric nervous system, we have got a formula. So each formula is to be given with 1 minute rest in between. We'll see these formulas, the real this thing also, the actual demonstration will be there. Okay. Then we target the pancreas to improve insulin secretion. The goal is to stimulate the beta cells to release insulin. Then we have got two formulas. One is CNNS gas, and another is 10pan×3. We will see how it is to be done. Then liver support. We have to do liver. For liver also, we got two formulas. One is called 6-toe finger liver. Another is called 1-point liver. This 1-point liver, many of you know. This 6-toe finger liver, I will show you. It's also very simple. Then we have got endocrine balance. The goal is to normalize hormonal control. And for that, we have a special formula, 1 PIT, 1 thyroid, 6 ADR. Okay. So 1 PIT, we'll see how it is to be done. Okay. Then uterus and placenta circulation. The goal is to improve fetal blood supply without overgrowth, because overgrowth is the real problem. And for that, a very good treatment is this 6-toe finger gall liver WD 4 times a day after meals. Okay. Then technique, we'll see how it is to be done. And then frequency and timing, minimum once daily. With people with the prior GDM history, they can go to 3 times daily. Then start before 24 weeks to prevent GDM. In fact, I recommend people to start right when they know they are pregnant, or even earlier. So then 5 sessions a week between 24 to 34 weeks gestation is recommended. So this is the first thing. Now we'll see it in great detail. First we'll see the formula, then I'll see how it is to be given. Now this elementary treatment protocol is recommended to be done at least once a day. In case of prior history, this may be repeated thrice a day. Okay. So digestive stimulation, it is for improving digestion and for gut hormone balance. There is one hormone called GLP-1 which affects insulin. Now GLP-1 is known as glucagon-like peptide 1. Glucagon-like, it is like glucagon. It's released by the gut after meals, playing a crucial role in regulating blood sugar and influencing appetite and digestion. Its main functions include stimulating insulin secretion, which is what we want, and then inhibiting glucagon secretion, that also we need that, delaying gastric emptying so that digestion can be proper, and then promoting satiety. For that, the formula is This is how it is to be done. 1, 2, 3. All these are to be done with 1 minute gap each. Okay. So now with this we will just see how this is to be done. Now I will be temporarily stopping this share. Then we will now see have hands-on demo on how it is to be done. Okay. Okay, now I am sure all of you can see me. Okay, so now the formula is called 8 pan. Okay, now what is 8 pan? Pan is to be given over here. Okay, pan is to be given over here. So we have to keep our hands, palms like this, back. We have to press downwards. This for people who have already attended, they know how it is to be given. Now for the newcomers, I am showing 8 pan means you have to press downwards over here, just in the center of the groin. You have to press downwards and you have to press 8 times, and each time you will hold the pressure for 6 seconds. Okay, and remember, when you hold the pressure, you don't do like this. Like this, you don't do. You just see. For example, I'll just show. I just keep my palm like this, both palms like this. Okay, and then okay, I keep my palms like this, and that's I don't do like this. I don't do go on doing that. Okay, I don't pump. Understand? So remember that. So because sometimes people in demonstration I have seen they do like this. No. Okay. So now how is 8 pan to be given? Now the palms like this. Place it over here, lean forward a little bit slightly, and now start 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. This is 6 seconds. Then remove and immediately same location 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Immediately remove 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. 7, 1, 7, 2, 7, 3, 7, 4, 7, 5, 7, 6. Last. 8, 1, 8, 2, 8, 3, 8, 4, 8, 5, 8, 6. This is 8 pan. Then gall. Gall is always on the left thigh. And depending on the length of the thigh, it will be, usually it will be in 3 locations. But suppose you are having a very small palm and then the thigh is long. Suppose, a granddaughter is giving to a grandfather. So the grandfather may be tall in height. The granddaughter will be having a very small palm. In that case, you may require 4 places, but otherwise we will give it in 3 places. So 3 places, how do? We just press downward and then we pull it inwards like this. So slightly pull it inwards. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then middle location 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then end location 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. These 3 together are called 1 gall. Then similarly, we give 1 spleen. 1 spleen over here. Okay, same way we will push inwards like this. Okay, spleen is on the right side. Gall is on the left side. Okay, so spleen on the right side. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. So this was 1 gall and 1 spleen. Then 1 liver. 1 liver, 3 points. So how do you give? 1, 2, 3. And here also 1, 2, 3. 3 locations. But in both these locations, you have to simultaneously press. That means I want 1 pressure here and 1 pressure in the first location. So how do? I press like this, and with this portion of the hand here, this bone, it will press on the groin. So like this. So 1 1, 1 2, 1 3, 1 4, 1 5, 1 6. Then middle portion. Immediately, this is middle portion. This is middle part of the hand, and here middle part of the thigh. Again, pull inwards. 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. Then immediately 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. So this is one liver 3 points. Okay, yeah, this is called one liver 3 points. Then you have got on the other side mucus, that is on the with the left hand, sorry, right hand and on the right thigh. So right hand and right thigh, how will do? I will do in 3 locations. 1, 2, 3. Okay, and here also 3 locations. So like this, pull inwards. 1 1, 1 2, 1 3, 1 4, 1 5, 1 6. Then 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. Third point, 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. So this is one liver, and this is one mucus, 3 points. So these 5 points, pan, gall, spleen, liver, and mucus. These 5 together are for digestion. These have to be done together. No pause in between, you saw. After this, we will give 1 minute rest, because the next portion, the next part of the formula, that is for absorption. So first we digest the food with this sequence. We start the digestion, that is, and then you will get the food absorbed by the intestines. A slightly different combination. Okay, in this combination, we won't be using spleen. Okay, after gall, we gave spleen, we won't be using it this time. For digestion, this is not needed. For absorption, sorry, for absorption, this is not needed. Okay, so now we do this very simple. Again, 8 pan. So 8 pan, again like this. Start now, we assume 1 minute is over. Then we start 1 1, 1 2, 1 3, 1 4, 1 5, 1 6. Same location, 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. Same location, 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. 4 1, 4 2, 4 3, 4 4, 4 5, 4 6. 5 1, 5 2, 5 3, 5 4, 5 5, 5 6. 6 1, 6 2, 6 3, 6 4, 6 5, 6 6. 7 1, 7 2, 7 3, 7 4, 7 5, 7 6. 8 1, 8 2, 8 3, 8 4, 8 5, 8 6. This is 8 pan. And this pan, in various places, it has got various sequences and various other works also. Then we come to, again we give gall. Okay, same gall, sorry, gall 1 1, 1 2, 1 3, 1 4, 1 5, 1 6, 1 1, 1 2, 1 3, 1 4, 1 5, 1 6, 1 1, 1 2, 1 3, 1 4, 1 5, 1 6. But now after the gall, we don't give spleen, we go to liver and we give it 2 rounds. So how do we do it? Same way, push it inwards. 1 1, 1 2, 1 3, 1 4, 1 5, 1 6. Middle point, 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. End point, 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. Then 4 1, 4 2, 4 3, 4 4, 4 5, 4 6, 5 1, 5 2, 5 3, 5 4, 5 5, 5 6, 6 1, 6 2, 6 3, 6 4, 6 5, 6 6. So this is 2 liver. Then you can 1 gas eye. Gas eye is given on the calf muscle. On the calf muscle, it is given like that. And we start from outwards and come to inwards. So you can spread out your feet. Now, if you are lying down and somebody else is giving the treatment, then you can lie down flat and get this treatment done by somebody else. Ladies, pregnant ladies, after the 4th or 5th month, they cannot do it on their own. Up to 3rd month, they may be able to do it. Or if they have difficulty, better somebody else should do it for them. Okay, now gas eye. This is 4 rounds we have to do. 1, 2, 3, 1, 2, 3, like that 4 rounds we have to do. Okay, we start. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Again here, second round, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Second round, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Third round, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Fourth round, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. 4, 1, 4, 3, 4, 4, 4, 5, 4, 6. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. So these two together are taking care of digestion and absorption. And then, because we want to increase, now we want to stimulate the enteric nervous system. In our body, we have got one nervous system in the brain. That is called the central nervous system. Then we have got one nervous system in the intestines, and that is called the enteric nervous system. Now we stimulate enteric nervous system by the same gas eye treatment, only we give it 6 times. Now we did 4 rounds, that is for digestion and absorption, that sequence. But when we do it for 6 times, it will stimulate the neurohormones, etc., the enteric nervous system. There are many hormones done over there, available over there, serotonin, so many hormones are there. So they will all be stimulated as per the body's need. So we don't have to bother. Whatever the body will require at that time, it will be stimulated automatically. We are just stimulating. By stimulating means what? We are sending the blood supply to the appropriate location. After that, the body will take care of itself. That's the beauty about this whole treatment. Okay. Then this 6 gas, I will not now show that because there are many more things to be shown. So those which have to be repeated, I will just say that it is 6 gas eye, means 6 rounds over here, and that should be done after about a minute or 2 minutes after the other digestion and absorption formula. So that is 6 rounds of gas eye, that is for the intestine, the enteric nervous system. Okay. Now this whole thing was for digestive stimulation. Then after digestive stimulation, what do we require for GDM, for the diabetes, any diabetes? We require the pancreas. We have to improve the insulin secretion. So for insulin secretion, what we have to do, instead of 8 pan, we will give 10 pan. Now I'm not going to give it because you have seen, this is only a demo class. So you have seen what is to be done. If any person requires a particular treatment for themselves, they can approach me later. Okay. So because then I can see exactly how they are doing and what corrections have to be done, etc. Okay. So anyway, 10 pan, that is for what? That is for improving the insulin secretion. And the goal is to stimulate the beta cells of the pancreas to naturally release more insulin, which is what we want in diabetes. Okay. But before that, before 10 pan, what we can do to improve the functioning better, we can do it. This entire thing has to be done before meals. So we have got CNNS gas, which I can show you here. It is very simple. Like this, we have to do 3 rounds. Like this. Okay. You can all see. Like that, we have to do. Like that, we press it and keep it over here. This stimulates the area between the solar plexus and the navel for better digestion. Okay. So like that, 3 rounds we can do and hold it for 6 seconds. So 3 to 9 rounds we can do it. Okay, very simple. And how do you know the result? Immediately you can see, you will feel here very light. This is the sternum bone. Immediately after the bone is a gap, is a small fleshy region. That is where your abdomen is. So that abdomen region, you will feel Absolutely no pain on pressing. It will be very, very soft after doing the treatment. Before the treatment, you may feel very hard, and then after doing the treatment, you will feel soft. So you can repeat it. I said 3 times or 9 times. 3 times for people who are already feeling soft. 9 times will be for 9 times or 6 times. They can be for people who are finding it is not yet, not yet the pain is not gone. For them, they can increase the treatment. So like that. Now for ladies, it is not easy to know this. It's not easy, when especially pregnant ladies, they cannot know anything whether there is pain there or not. For that also I will tell you. You give 3 times and then see how you feel. Sometimes you may get some belching, some burping, etc. But after that, you will feel very comfortable. If you are not feeling fully comfortable, do another 3 more times. If you are not feeling comfortable, do 3 more times. But after that, stop. Don't give too much also. 3 times is enough. If you are doing regularly, if you are doing it before every meal, then you can 3 times is more than enough. And after 3 times, you can do this 10 pan. So first you do this treatment 3 times and then you do 10 pan. So then it's very easy. Then that way I have helped the digestion also, and then I have also activating the pancreas also. Okay. So after that, you require the liver support. Why? Because the liver also helps to reduce insulin resistance. So for that, this liver is slightly, there are two parts to it. One is called 6-toe finger liver. Now 6-toe finger liver, how do you give? Now I am just showing you here. The fourth toe over here, that is called the liver toe. The fourth toe. Okay. The fourth toe is the liver toe. Okay. And now what we have to do is we have to keep our finger like that and then just make a twisting action like that. And in 2 locations. So that means one, I will show you from here just like that. See, I am putting one finger like this. I am showing once this finger and then another I am doing like that. And how am I twisting? I will show you the twisting action. Very simple. So it is just like this. 1, 2, 3, 4, 5, 6. Then this way. 1, 2, 3, 4, 5, 6. So what I did like this, I did like this 6 times, and I did with my finger inside. With my finger inside, I can do like that, like this 6 times. So 6 times in 2 locations. Twisting only, gentle twisting. In the beginning, many of you may have pain over there. Don't worry. That pain means the remote control has not been activated for a long time. Battery is dead. So you are reactivating the battery. So if it is paining too much, just give it gently. That's all. Whoever who does it to their person, lady, then let them do it a bit gently. That's all. And if you may feel pain, don't worry. After 3-4 days, the pain will go away. Understand? So don't just give up saying, oh, it is very painful. No, it is not painful. It is only reactivating the remote control in the body. Understand? So there may be some initial little bit. In any treatment, there may be some pain on the first day. Do it softly. That's all. But don't give up. Okay. So this was 6-toe finger liver. After that, we will come to the 1-point liver, which we have seen earlier also. 1-point liver means the same liver point which we gave all together, we will have to give it one at a time. 1 point here, 6 seconds, wait. Then wait for 1 minute. Then go to the next point, 6 seconds, wait for 1 minute. Then go to the third location, 6 seconds, wait for a minute. Again, 4th location, 5th location, 6th location. That is called 1-point liver. Remember this, 1-point liver means I have to give 1 minute rest in between. And other liver, when it is written 2 rounds, 3 rounds, we will have to do as this, as per the formula. So like that, we have, you may question, why this, what is the difference? If I am stimulating liver, any liver is okay. No. When you stimulate the liver in different regions, different chemicals which are needed for the body will automatically be produced. That is the beauty. The body will take care of whatever you need. It is like a mother, no, the liver. You all know, liver is the mother of the body. Does the children or the family have to tell the mother every time, I need this, I need this? No, the mother knows. She has her own schedule. Only she should be given the proper stimulation. Okay. So like that, the liver, by our stimulation, it will produce the proper chemicals, whatever is needed for the body on that particular day for that particular one. That is the beauty. Because sometimes people will ask me, sir, you are giving liver, what chemical you are making? No, I know a number of chemicals which the liver is making, but whatever chemical is needed for the body for that particular person on that particular day will be given by the liver automatically. That's the beauty. Okay, and that is all done by a negative feedback system. It is a scientific principle only. Negative feedback system exists in the body and the liver will work accordingly. Understand? Okay. So now we gave liver support, we gave the pancreas, then we gave the liver. Then we have a treatment which has to be done only on another person, only by another person. It cannot be done by oneself, because it requires, the treatment requires the person to lie like this on the bed. The ladies, when they lie on the bed flat, they should not keep their legs fully stretched, because if they keep their legs fully stretched, there is an arch of the back over which the weight of the baby will press down and they may have pain, hip pain. So what they should do, there are two ways of reducing the hip pain. One is to keep their legs slightly near the body. Another is to keep a towel or a bed sheet folded and then just where the arch is, then you feel very comfortable. In fact, any of you who has back pain, even that lady, I think Mrs. Yasmin, who had this fractured this thing, I think she also may benefit by keeping a towel or a bed sheet over there to support the arch of her back. It all depends. Some people have flat backs without much weight, but some people who are a bit bulky, they may have an arch over there in that region. So for them, it is very useful to keep a small pillow, not pillow, sorry, the towel or a bed sheet over there. Okay, so this any pregnant lady also can do the same thing. They will feel comfortable if they are lying flat. Otherwise, many of them prefer to sleep on one side, maybe, then it's all right. That's up to them. But for this treatment is to be given like this. The patient has to lie like this. And then where is the treatment given? One point is over here. Both hands together. Both hands together like this. Like this, somebody has to press. 6 seconds pressure over here. Understand? Over here, just on this point of the elbow, over here and over here, simultaneously. Simultaneous pressure like that. Okay. So simultaneous pressure like that, and then 6 seconds pressure, and then after that you 6 seconds pressure here, over here, like that. You have to give 1, 2, 3, 4. So 1 on both sides, then 6 seconds, then 2 pressure just outside the shoulder joint, like this, 2. So this is 2 locations, then twice more again, 1, 2. So this is called 1 pit. Then after that, a mild jerk over here, it is called 1 thyroid. Just give a jerk like that. Just a small jab, 2 jabs. That is called 1 thyroid. Then the third one is called 6 ADR. 6 ADR is a treatment where you are going to give like this. You have to give. Where you have to give, it's a very simple treatment, but it has to be done only on another person. I have definitely I have put 6 ADR treatment, shown it how it is be done on my daughter. It is there in the group, but I'm just telling you, it's a very simple treatment. And 1 minute. And 6 ADR treatment, these 3 together, they are for stimulating the endocrine balance normalize the hormonal message that regulates insulin and blood sugar. So these 6 ADR is one PIT, one thyroid, 6 ADR. This is a very good sequence. So like that we have got for GDM, we have got so many sequences. Then after that you have got a formula for the uterus, for strengthening the uterus. This formula can also be done either by oneself or by another person. Very simple formula. Very simple, because it requires some of these previous points. I will tell you how these points are to be done very simply. Now for that, I think I will be switching on another camera. I will try to see whether this camera can be switched on, and I will have to first 1 minute. Please wait. I will give you a better closer view, because then it's very simple, and this is very useful for ladies. Just hold on a minute. I have to spotlight. Yes. Okay. Now I will not add spotlight. I will add spotlight. Okay, now you can all see. It's a very simple. This is a better, very close up. See, I'm giving you all of you in close up. Now you see, this is the third toe on the left leg. This is the third toe on the left leg. This is the fourth toe. And then these are the 2 little toes. So these are the toes we have to work on. Here, here, and then here. Okay. So these are the toes we have to work on. So how do I do? It's only, again, same. It is only 6. The 6 one, 6. Okay, 6. 6 I am giving 6 times. What I am doing? Fourth toe. I start with gall, third toe, then fourth toe, then little toes, both leg. So let me see how to do it. So again, I have to twist like this. So now all of you can see. See, this is the third toe. Okay, this is third toe. Okay, I have to show you. Okay, now I am working on this toe. Okay, on this toe, third toe. So I am doing like that, and then gently pressing inwards, and then 1, 2, 3, 4, 5, 6. Okay, I do one like this and one like that. This is 1, like that 6. Then I put my finger inwards like this. See, like this. 1, 2, 3, 4, 5, 6. Okay, so 6 here and 6 here. Okay, then come to this toe, fourth toe. 6, 1, 2, 3, 4, 5, 6. Then come here. 1, 2, 3, 4, 5, 6. So these 2. So first I did third toe, then I did fourth toe. Now I will do both toes together, fifth little toes. The little toe I will do together. You see, same way. 1, 2, 3, 4, 5, 6. Then here 1, 2, 3, 4, 5, 6. So what I did first left leg, third toe, then I did fourth toe, then I did both toes together. So this is this 1 round or 3 rounds, you can do this. Okay. Now 1 round or 3 rounds you can do. Fine. So 1 round or 3 rounds you can do. Like that you should do 4 times a day. And this can be done by all ladies, irrespective of whether you are having any problem or not. It is an absolutely safe but very, very effective treatment. It helps in so many disorders of the uterus. So many disorders. Of course, many disorders may require other treatments in addition, no doubt. But this is very simple treatment. Any lady can do it on herself and then get result. Understand? They get a lot of benefit. You get energized, you get your even your periods can get streamlined, etc., etc. So many advantages are there. Okay, so this is one thing. Then, so with this we have got a more or less a good this thing about how to treat gestational diabetes mellitus and what is the frequency. Then it at least in the week 24 to 34 weeks of gestation, at least you should have 5 sessions per week. Preferably all 7 days, but at least 5 days of the week you must do this so that you can stay very healthy. Both the mother and the child both will be very healthy, and there will be absolutely very few problems, or there may be no problem at all. Okay, so this is very good thing. Now we will go ahead with the next one. The next one is called how to prevent gestational diabetes. For this I will have to share the screen. So I will share the screen now. How to prevent gestational diabetes. Okay, now wait a minute. Okay, now so yeah, I think this is okay. This because you will have to see this PPT PDF. So this is okay. So preventing gestational diabetes mellitus. Okay. Okay. Simple steps for mothers to reduce their risk and support a healthy pregnancy. So that is why it's very useful. Why prevention matters? Because we have all seen GDM increases the risk of high birth weight, cesarean section, high blood sugar in the baby, and the mother developing type 2 diabetes later. So early action can prevent or delay these risks. So what have we to do? Some of these may be repetition. Maintain a healthy weight before pregnancy. Try to achieve a healthy BMI before conception. Losing even 5 to 7% of excess body weight can improve insulin sensitivity. Okay, so how do you reduce body weight? Simple. Do first this the sequence for digestion and absorption, and then you do the sequence for the uterus, that is on the toes. Very simple. At least if you do these two things, and now and then give 10 pan, so the entire sequence can be done once a day. But at least you should do digestion and absorption treatment at least before every meal. You do it, and do liver. Then you will see that your insulin sensitivity can improve very well. Okay, so and your excess body weight can reduce. Then eating a balanced whole food diet, we have already spoken about it. So focus on foods that stabilize blood sugar, and brown rice, oats, and quinoa are very good for whole grains. Then fresh vegetables, especially leafy greens, and then cruciferous vegetables. Now here one problem sometimes comes, because many of these leafy greens, they have certain worms, etc., and then people naturally they don't like it natural, which is true, and or otherwise they may have they may overboil it. So what they should do is, better than overboiling or frying in oil, etc., which is not good for that vegetable and not good for our body. What we should do, soak these leafy greens or cruciferous vegetables, soak it in brine, salt water. Take 1 spoon of salt, put it in the water, and soak this leafy green for about half an hour or 1 hour before you start cooking. And then you can steam cook. Then you can naturally, while you soak it, and all these things will mud and everything will be washed away. Then first you wash it and then you soak it. Then all those things will go away, and then after that it will become safe. And then steam cook it. Do not fry it. Do not fry fresh vegetables. Then they lose all their freshness and they lose all their value. Nutrition value is zero. If you fry a fresh vegetable in oil too much, you can have steam cooking and then you can, on that you can sout, tadka, as we call. So that is very good. Then legumes and pulses are very essential. And another thing is healthy fats, nuts, seeds, and slight cow's ghee. Just a small quantity of cow's ghee is very much essential, because all female hormones are dependent on cholesterol, and cholesterol, one of the good sources of cholesterol is cow's ghee. And it is, so long as you don't fry anything in ghee, cow's ghee is very good for the body if it is taken raw, over chapati, over rice, etc., whatever you are eating, over quinoa, over brown rice, etc. Okay, then for those who have to eat non-vegetarian food, for them lean proteins such as eggs, fish, paneer, that is very good. And then limit processed carbs and sugary snacks. We have seen this already earlier. And sweetened beverages like, Coca-Cola, etc., all those things, sweetened aerated waters, they should be avoided. And deep fried items should be avoided. Then, of course, we have spoken about physically active. Walk at least 30 minutes a day. Okay, unless advised otherwise by your doctor. Okay, and in this case, I always say everybody, rather than just simply walking on straight ground, as far as possible, till you are able to slightly try to climb only, even if you climb 10 stairs at a time. Climb up 10 stairs, then come down, up, down, like that you can go. So that is very good for the body. Then movement improves insulin response and mood. Movement also improves the mood. So if you see, if you are feeling a bit sluggish, you are feeling a bit drowsy, then your mood is not very good. You don't want to do any work. But the moment you start moving, anything you do, even keeping 2 chairs in the house and making a figure of 8 like that between the chairs, even that is very essential, very useful. Just 2 chairs. Keep making a figure of 8 like that, okay, that is very useful. So this is all very good. Then monitor blood sugar if you are at high risk. So if you had a GDM in a previous pregnancy, or if you are overweight or obese, if you had PCOS, or if you have a family history of diabetes, if you are over 25 years of age, then you may be at high risk. So you should always keep on monitoring the blood sugar. Okay. Then manage stress and sleep. This we have also spoken earlier, that how stress affects the cortisol, hormones like cortisol, and cortisol impairs the use of insulin. Then aim for 6 to 7 to 8 hours of quality sleep, etc. Then use elementary techniques for prevention. One is this digestive stimulation, pancreatic activation, liver support, hormonal balance, placental circulation, etc. Then once daily or 3x if you are at high risk. Start by 12 to 16 weeks if possible. Though 24th week is mandatory almost, but if you start by 12 to 16 weeks, it is even better. Then follow your prenatal schedule strictly, track your weight, blood pressure and sugar, and then communicate with your care team about changes in energy, appetite or swelling. Yes, this is very essential. If you feel any change in energy, appetite or swelling, then you should talk it with your gynecologist. So prevention steps are pre-pregnancy weight management, balanced whole food diet, daily movement, early screening, if reduce stress and improve sleep, elementary support protocols, and stay consistent with checkups. So these are the ways in which we have seen we can prevent gestational diabetes. Now, after this, we come to our PPT, main PPT. Just hold on. Okay. Okay. So now, so to sum up, gestational diabetes is treatable, and with the right care, most women go on to have healthy pregnancies and healthy babies. That is the best part. With right care, most women go on to have healthy pregnancies and healthy babies. But at the same time, it is also a window into future health. because it gives us an opportunity to intervene early and prevent type 2 diabetes down the road. Okay. Now we have a small quiz coming up. I wish some of you or all of you can take turns in answering. There are only 5 or 6 questions. Okay. So let us see this quiz. Very simple questions, but it stimulates the brain. Up till now we have shown you treatments, we have shown you so many things, I have told you so many things about gestational diabetes. I have told you that there is nothing to worry, but it should be tackled immediately, etc. But then, how do you define diabetes? There are 4 answers. One is a metabolic disease characterized by low blood sugar. Another, metabolic disease characterized by high blood sugar. Third is a family of blood infections. And 4 is none of the above. So anybody, they can, of course, I will give the answer later, but I would like if somebody of you can try their hands at answering this question. You can raise your digital hand and then I can ask you and then you can answer, because otherwise everybody raising hands at the same time is not good. So let us see if somebody will volunteer. Otherwise, of course, I will have to give the answer myself. But it's very useful to know this. Is diabetes a metabolic disease? Yes. Then yes, Jnanashekaranji is answer is this thing. Please, sir, unmute and talk.
B.
Metabolic disease characterized by high blood sugar. Very good. Thank you very much, Mr. Jnanashekaran. So, what is the explanation? Diabetes mellitus, often referred to as diabetes, it's a group of, first of all, you understand it's a metabolic disease. That means the metabolism of the body of carbohydrates handling is lost, and it's a group of metabolic conditions. It is characterized by elevated levels of blood sugar, and then it results from problems with insulin action or secretion from pancreas. So either the pancreas is not secreting or the pancreas is secreting and the insulin is not able to be used. Okay. So next question. Diabetes can be cured with diet, exercise and medication. True or false? This is a very simple question. Many people should be able to answer this question. Can it be cured with diet? Yeah, Sister Mercy. Yes, madam. Go ahead.
Yes, sir. True, sir.
Yes. So this is what I want you to understand. It can be cured with diet, exercise, medication is the last. So diabetes is not incurable. Many people sometimes have the feeling, oh, that means once a diabetic, always a diabetic. No, it can be cured. It may take time. It may take few months. And with neurotherapy, within few months, you get permanent results also. So that is the medication. Instead of medication, we recommend neurotherapy. Okay. So that is, but according to allopathy, the correct answer is true. So understand, according to allopathy, it says there is no cure for diabetes and it persists throughout life. This is what allopathy says. We in neurotherapy, we beg to differ. Okay, we have handled so many cases. In fact, the last diabetics challenge case, the challenge class itself, we saw almost 50 people had got benefited out of 75. 50, that's a very good number. So I want all of you, when I next announce my class, please attend it and then please take part and get the benefit. Okay, so diet, exercise and proper elementary treatment can help bring down glucose levels and eventually the person can be free from disease. Even serious chronic patients can be free from complications. That is the beauty. Serious chronic patients can be free from complications. Okay, now the third question. With type 1 diabetes, the body does not produce insulin. Is it true or false? Type 1 diabetes, do they produce insulin or do they not produce insulin? Somebody else can answer. Sister, okay, never mind. Sister, please you answer. Sorry. Yeah, please, sister, you can answer. What do you feel?
I feel A, sir.
True. Okay, fine. Okay, Jnanashekaranji, do you have any different answer? Or
Yeah,
is it the
only,
same?
sir. Yeah.
Very good, very good. So, very simple question, of course, but still, I want people to start waking up, not feel drowsy. So that is why I am asking these questions. So the correct answer is true. A. However, people with type 1 diabetes who take regular NT treatment are able to reduce their insulin dosages and are able to manage rapid fluctuations and see tangible improvement in the quality of life. So all of you understand that diabetes with proper NT treatment, even type 1 diabetes, type 2 diabetes of course got benefited. In type 1 diabetes, we have got several cases in the previous diabetes challenge group that people were able to reduce their insulin dosages. They are able to manage rapid fluctuations because type 1 diabetes, rapid fluctuations. Suddenly the sugar level will be low if their insulin happens to be a bit more than the activity what they have done. See, it is always related to their activity. So the fluctuations will be too much. But we saw 2-3 ladies have confessed who were in that group. They had said that they were able to handle their rapid fluctuations very well. And then they are able to see tangible improvement in the quality of life. Okay. So now which of the following is not a symptom of diabetes? Itchy skin, thirst, frequent urination, and muscle pain. Which is the one which is not a symptom of diabetes? Who can answer this? Somebody else should try. Why only 2 people are trying? You want more people? Yeah, you want, let us see, somebody else, will somebody else volunteer other than Sister Mercy and Jnanashekaranji? Only 2 people are there. Are they only the people who are studying well? I am sure other people. Let me call somebody. Let me see. Kiranmayi ji, why don't you try your hand? Which of the following is not a symptom of diabetes? Kiranmayi ji, I am inviting you to take part. Rather, I am forcing you rather. You are not there. Yes. Kiranmayi ji, can you unmute and talk? Give any answer you like. I will correct it later. Kiranmayi is not answering. Okay. Now, Fedwa. Yeah, Fedwa. Mr. Fedwa. Please unmute.
Itchy skin, sir.
Muscle
It is
pain.
Muscle
pain.
Pardon? Itchy skin.
It is
Itchy skin. Not okay. Yeah.
itchy skin for 4A.
Okay. Yeah. Okay. Fine. Anybody else is there?
The muscle pain, sir.
Prem Lataji. Prem Lataji, do you want to talk?
Yes. Itchy skin, sir.
Wonderful. Okay. Thank you. Jude is co-host. Okay then. Fine. Thank you. Ilangovanji, do you have any other answer? Do you think frequent urination or muscle pain? Anything? Ilangovanji, yes, please answer. I am not able to ask you to unmute. You are not able to.
Muscle pain, sir.
Muscle pain is not a symptom of diabetes. Okay, that's a good try. Muscle pain. Now we'll see what is the correct answer. Okay, muscle pain, according to Mr. Elangovan, it's not a symptom of diabetes. Other people have said itchy skin is not a symptom of diabetes. Now let us see what is the truth. Okay, correct answer is muscle pain. So those who answered itchy skin, you should please understand the correct answer is muscle pain. Why? Let me explain. Diabetes affects many different body systems and causes a number of symptoms, including excess. What are the symptoms we said here? See, we said itchy skin, thirst, frequent urination, muscle pain. Now, itchy skin definitely is a symptom of diabetes. Many diabetics have this thing in the groins. Skin itching will be there. It's very common in diabetics. Okay. So then some people will have excessive hunger, thirst. Thirst is very common, feeling thirsty because they are urinating often, so they will feel thirsty often. Okay, and dry mouth, the mouth becomes dried. Then tiredness, fatigue, unexplained weight loss, headaches, and vision changes. Okay, but muscle pain is not always there. There may be numbness in the toe. See, that is a different thing. Numbness in the toe can be there. Numbness in the sole may be there. Numbness in the sole of the foot or the toe. That is no doubt there. But muscle pain is not always accompanied in diabetes, or diabetics do not always have muscle pain. They may have numbness. They may have calf pain in case they have calcium deficiency. Calf muscle pain only for those people who have calcium deficiency. So that way muscle pain is not there, but so many other symptoms are there. That is excessive hunger, thirst, dry mouth, increased urination, then vision changes, tiredness, poor healing of sores. This is a very, very common thing. Sores don't heal properly. Then vaginal infections, then impotence, weight gain, numbness, or tingling of the extremities. See, many people may be confusing this tingling of the extremities with muscle pain. Muscle pain is different. Tingling of the extremities is most likely in the toes, and sometimes people may have tingling of the fingers. So that, okay. So, and itchy skin can also be associated. Many people have itchy skin. Okay. So please, those of you who have made this thing option, please understand. Muscle pain is this thing. So I again go, which is not a symptom of diabetes. Itchy skin is a symptom of diabetes. Thirst is a symptom of diabetes. Frequent urination is a symptom of diabetes. Muscle pain is not a symptom of diabetes. Okay. Okay. Now the last one. Insulin is a natural hormone secreted by which organ or gland? This is just to make you, all of you, a bit waking up. Okay. So this is very easy thing. Still, I want somebody else to answer. Let us see. Okay, we'll take Miss Fadwa. Please, somebody, anybody. Joginder. Yes, Joginder. Tell me. That's right. Now I am.
It's pancreas.
Okay. Oh, acha, pancreas. Anybody else has a different answer, then they can give.
Liver.
Right?
Liver.
Liver. Okay, liver. Okay. Then anybody else? One is pancreas, one is liver. Then anybody else has any other this thing? Any other answer? I don't think so, Joginder. Ilangovanji, do you have a different answer?
No, sir. Same. Pancreas.
Pancreas. Okay, fine. So that's all right. 2 people for pancreas and 1 person for the liver. Now let us see what is the vote. The correct answer is pancreas. See, the liver, it manufactures many hormones. I mean, many chemicals it manufactures. But insulin is the natural hormone secreted only by the pancreas. No other hormone, no other gland can secrete pancreas, the insulin. Of course, spleen secretes something else. It is more smashan. That means a burial place for the RBCs. And the kidneys secrete other hormones called 125-DCC, etc. But the pancreas secretes insulin. Okay, with this, I have come to the theory session is over. Now we can take any questions if they have. People can start raising their hand and they can take the questions. I can take. Anybody wants a repetition or anything like that, I can take. Okay.
And click on your videos for queries.
Yes, who wants to? Sister Mercy has the question.
Yes, sir.
Please,
Good evening,
madam.
sir.
Yes, good evening.
Thank you for the exercises, treatment. Thank you so much, sir. Sir, you said no, sir. Right side, same like liver.
Pardon?
Right side, you told no, sir. One side is spleen, one side is liver.
Yeah.
Then before that gall one, you said the right side. What is the name, sir?
I will repeat it again. Gall is on the left side. Gall is the treatment given on the left side. On the right side, it is called spleen. On the
Yeah.
right side, gall, spleen. Then
Yeah.
left side is liver, right side is mucus. We call it
Mucus.
mucus. Nah,
Mucus.
like the mucus from the nose, na.
Acha.
So what happens?
That's a name I'm not getting. That's why I
No,
asked.
I agree. And doesn't matter. No problem. Please ask. Right?
Hmm.
Always I like people to ask questions, because when I am giving so much time, then you should get the complete knowledge, isn't it?
Then, sir, you said 6 places, but you showed in the hand, here in the groin, here in the elbow side, and here, and left side, and here. But only 4 side you showed, but you said 6 side.
No. Then maybe I have made a mistake. It's only 4.
Only
Four. 4 like this
okay.
you do, and then 4. Yeah, that's only 4.
But it's not 6, no, sir. Only 4.
No, not 6. 1, 2, 3, 4. That's all.
That's why I'm asking.
Yeah.
But you said 6. That's why I'm asking.
No, I made a mistake.
Okay, sir. Thank you so much.
Okay, welcome. Then no
Thank
problem.
you. But this is
Pardon? You are muted.
this 4 places for what, sir? For what treatment? Back pain.
No. This is the one for that. That should not be given alone. Alone, it will increase the sugar. It has to be given in those 3 sequences: 1 PIT, 1 thyroid, 6 ADR. This whole thing is for hormonal balance.
Acha.
So that is for balancing the hormones.
Not for hip pain.
No.
Hormonal imbalance.
Yes. And that is only for, that is to be given only after all the other treatments have been given. In that sequence only it should come.
At last only.
Yeah.
Say like that, so many people are going to allopathy and in some other treatment and all they are going, if they are not getting cure, slowly they will come to this natural therapy, like that.
They should come.
So like that, like that only, sir.
Yeah.
Okay.
Yeah.
Thank you so much, sir.
Okay, welcome. I think nobody else has raised their hands. In case, I will give a couple of minutes. Otherwise, of course, it is still almost 8:45. 9:45 or so, 9:41. So we can call it a day. Okay. So let first Anusha madam sum up. Then I will give my blessings. So I want people to wait till the end.
Yeah. So actually, I request everyone to please go to the group and share your feedback on this session, so that sir will know how many of you have participated willingly and understood the concept. So I request all of you to go back to the group, Joshys Kerala Telegram main group, please. Your actually sir is not there in WhatsApp group. So please post all your feedbacks, all your queries, all your, love and affections in the main Telegram group only, so that sir can go through. Thank you so much. Now I pass it on over to sir to finish the blessings, so we can finish our day. Thank you, sir.
Yes. Okay. Again, I thank, there are about 9 or 10 people who have given their good remarks on the last class, but I expected a little bit more. But we wish that this thing. 1 minute, something else has come up. Okay, that's all right, not for me. So I request all of you. I want, at least there are almost 60 people now. 60 means 58, and 58 or 57. So rather than writing me any thanks here, I want you to write in the group so that people can understand. And whatever you are feeling, it should not be just simple thank you. You can say whether that the neurotherapy should be, more people should come forward to learn this neurotherapy. Like that, that sort of a constructive remark will make other people this thing. If I say my product is very good, I as a seller may say it's very good, though I am not really trying to sell anything. But if you who have listened to me, if you comment properly, and if you comment in a not just mechanically, thank you, sir, wonderful, sir, not only like that, something more than that, then it will make a bit of a meaning. Because I want to to give all my knowledge to all of you, but I want more people. I don't see many more people. I don't know about other classes, but there are not many people here. 50, 60 is a small, it's a very small sum for, I mean, small quantity for number for Joshys Kerala Group. 7,000 people are there or 8,000 people are there. So this is really a small quantity. So please, all of you, make efforts to help me, promote me, not for by doing anything, just write properly about my classes, so that other people who are not attending will at least attend my future classes. Okay, this is the best thing. This is the best request I can make from all of you, or for all of you. So now, very wholeheartedly, I pray. I wish all, each and every family member. 1 minute. So I take this opportunity to wish each and every member of this group and each and every member of Joshys Kerala Group and their families and friends a life full of health, harmony, happiness, peace, prosperity, and success. I wish all of you and your families a life full of health, happiness, harmony, peace, prosperity, and success. Thank you very much. Good night. Thanks to all of you for attending this course. Thank you very much. God bless all of us. Okay. Yes, madam.
But sir,
Okay.
from all of us, with wholeheartedly, we send you gratitude for this session and all the sessions altogether at Joshys Kerala Group. And to participants, I request you to please elaborate, because elaborating how you gone, how this class went, what you learned from this class, how it was taught to you, and how you gathered all this information and you were able to, listen to this class and collaborate it in the form of a therapy for yourself or for others. That is very important, because unless you, those who have attended, go there in the group and say thank you, that is not enough. That is not going to help. So please, I request all of you 45, 48 people to please go into the group, main group, and elaborately write your feedback, your, if any, like whatever up and downs you are facing also, you please write down, because as a member, some other will be going through all your elaborate information about this class. They'll be interested. So this interest will raise or, create an interest in them, enthusiasm in them to attend these sessions. So this will help them also, and not only you, others also. So we request an elaborate information about this session and how best you understood from this session, because everything was taught to you. The physiology was taught to you, how it has, the root cause was taught to you, how to do treatment is also taught to you, and very effectively. And you were also put under sort of questions, so that, you would understand the concept better. So all these are put together, a class is made for you, taking time, making all these PDFs and all the information put together, because forgetting one information, missing one information, sir never does that. He takes extra classes also for you. For example, if he says only part 2 is there, but he takes it to 2, 3, 4, 5 classes also, just to complete all the, information of a particular subject. And not only that, everything is covered. If you are asking to repeat, sir is very dedicatedly and patiently repeating all the sessions to you, all the treatments to you, and clearing away all your doubts. Some of you are not raising doubts also. So please raise your doubts in the class itself, because when the time is there, you have to understand immediately. When you come out of the class, you might not remember your doubts, and you might not be like, you might become lazy to write it down in the group also. So which is not, worthy. So we at Joshys Kerala Group with Ramachandran sir request each one of you to elaborately write down the feedback of this session and every session always, not only today, but every time whoever are participating, you the only thing energy exchange you can give is this feedback. So please understand the importance of writing down, because just thank yous is not going to work. Okay, that's why I'm not opening your mic buttons also, so that you can write whatever comes into your mind. You can write it down easily rather than expressing a thank you for 1 second is not enough. So we request you kindly, humbly, and with all gratitude to please write down your full feedback in the group, so that everyone will know about this neurotherapy and how best they can use it for themselves and for others. Because alternative therapies, learning multiple alternative therapies is also very important. And every time one therapy is not going to help. And when you have more wide knowledge, that will help you in treating the person better, the patient better, the family better, or a friend better, or a person in need better. So please understand, and thank you so much for attending this session, and wishing you all a very happy weekend. And now ending this session, sending all your gratitude to Ramachandran sir with Joshys Kerala Group for this wonderful session. And I guess there is one more part 3 of this session, because I didn't see the PDF to be completed in this session. So I guess there will be another session of part 3, sir, for this session.
No, it's over.
It's over?
Fine.
Okay.
Yeah.
So next session will be informed in the next Thursday or Friday about the topic, etc. So till then, let's catch up, go through all the videos. See, unless you request for the recordings, we are not going to provide it, because you people have been lazy in attending the sessions. So you don't be lazy in asking for recordings. Unless you ask, the recordings won't be provided. So please note this also. Okay. So attend, share links to your friends, family, and other needed according to the topic. Please send it to the needy, so that they can attend and get benefit out of this, because all of your friends or family or students or whoever is going through whatever, they might not be in this group. So this sharing will help them also, and their blessings will be received to you directly. So please note. Thank you so much. And gratitude, sir, from all of us. Thank you for wonderful sessions for Joshys Kerala Group. With all I had gratitude, heartfelt gratitude. Ending this session. Happy weekend to you, sir, and your family. Wishing good health for you and your family. Thank you so much, sir.
Thank you.
Night.
Okay,
Right,
good night.
ending this session. Tomorrow again 7:30 p.m. Please attend Equipaper Therapy and follow the messages, so that you can attend all the sessions without fail. Thank you so much. Good night, sir. Bye, sir. Bye,
Good night.
everyone.
Good night.